picked up a tennis racket. Kind of like in this picture, this is going to be pain over the outside of the elbow. So this area right here on the outside of the elbow. Remember, cubital tunnel is that nerve on the inside. Tennis elbow is pain on the outside of the elbow. This is usually pain with lifting with your palm towards the floor. So one of the great or best examples I have is like ladies who are driving and they maybe have their purse in the passenger seat. Whenever they go to reach it and they extend their elbow and they have their palm down and they pick up their purse to lift it out of the passenger seat, with tennis elbow, that motion is going to be really painful. Gripping or twisting, like wringing out a towel, that's going to cause pain with tennis elbow. Prevention is proper lifting technique. So you want to try and lift things as best you can with your elbow bent and your elbow by your side with your palm up. That's going to use a totally different set of muscles and it's going to protect the muscles on the outside of the elbow. Stretching, remember if you have those repetitive motion jobs, you want to do those wrist stretches down and back as frequent as you can. Usually, if you could do that just a few minutes in the morning before you get started, and then a few minutes late afternoon before you get done, that's going to help. And then warming up for exercises such as playing tennis or pickleball, which we'll get to it later on, and warming up with those stretches. Patients usually say they have pain with shaking hands or lifting a large cup. I have a lot of patients that drive trucks and they'll have like a drink and they'll say they have pain when they go to lift that big drink. That's also can be signs of tennis elbow. At home, you want to do rest. You want to rest from the activities that are bothering it. You want to put ice to that area. Voltaren gel or icy hot, again, can be good here. A counterforce strap, that's something, again, that you can get off of Amazon or get at your local pharmacy. It's going to be a strap with a bubble inside of it, and you put that bubble just down from the area of pain, not over the spot of pain, but a little bit more towards your hand. If you wear that during the day when you're doing these exercises, it'll help it to feel better. If you have pain that lasts more than a couple of months without home therapy, come in and see me. Tennis elbow can be pretty tough to treat, whereas the trigger finger, I can normally make it better in the same office visit. Tennis elbow is a little tough. It usually takes a lot of work to get better. And so if you're having these symptoms, let me know and we can work on it together. Shoulder arthritis. So this is another thing that I studied when I did my year of extra training. So it's something I like to take care of because this is a way I can really impact someone's life positively. This is much like the arthritis that we talked about in the base of the thumb. It's whenever the cartilage becomes diseased, and that usually happens with time. I tell my patients if we live long enough, we're all going to get some form of arthritis. Just some people get it in different areas. Some people get it earlier than others. Some people get it more severe than others. And there's a component of biology there that we honestly don't have completely figured out, but we do have good treatments for it. For this right here, you're going to have stiffness and grinding. That's because that cartilage that should be firm and slick is becoming soft and brittle in the shoulder. And so instead of the joints and the bones kind of sliding, they're rubbing. And whenever they rub like that, they cause inflammation, which causes the lining of the joint to get inflamed and becomes painful. Usually with arthritis, you're going to have pain with all shoulder range of motion. You're going to have pain when you're moving your arm by your side. You're going to have pain reaching up. Definitely going to have pain if you're holding something out away from your body. Prevention is just trying to maintain mobility and doing lightweight exercises, which we have some band exercises I'll show you when we talk about rotator cuff tears. You can do those for shoulder arthritis as well, and I'll show you a picture of that in a little bit. This right here is what's called a shoulder walking maneuver. Basically, you can put your hand on a wall or even lay down and put it on a bed in front of you, and you're just trying to get that arm to go all the way up so you can get full forward flexion and full extension. Doing that regularly will help keep your shoulder healthy and mobile. Pain with most shoulder range of motion is usually what my patients complain of with this. Doing the gentle stretches, heat and cold therapy, icy hot usually works a little bit better. I find the Voltaren gel usually works better for smaller joints like hands and feet, whereas larger joints, icy hot, my patients seem to say helps a little bit more. Whenever you have pain that's limiting your daily function, like every time I go to wash my hair, every time I go to put my shirt on and off, or every time I reach behind me into the back seat of my car, I have pain. That's when you want to come see me. We've got good treatment options for these things, and they don't all involve surgery. Rotator cuff tear. So this is the one that everyone's afraid of, and for good reason. It's a big injury. There's good treatment for it, but the recovery process can be quite extended at times. And so whenever the rotator cuff is a series of 4 muscles that goes around the shoulder, and they're small muscles that help stabilize your shoulder through range of motion. And so if you develop a rotator cuff tear, your shoulder is not going to be as stable. And that's going to lead to weakness, predominantly with an outstretched arm. Like if you're trying to open the refrigerator, reach in, grab a gallon of milk, and lift it to put it on the counter. If your rotator cuff is injured, or definitely if it's torn, that's going to be difficult and a lot of times painful. Nighttime symptoms. Patients say they have pain when they're laying on the affected shoulder, sometimes even laying on the opposite shoulder. Difficulty lifting the arm, usually with the elbow extended. For prevention, you want to do rotator cuff strengthening, and that's what this gentleman's doing here. You want to get one of these bands, usually lightweight, 5 to 10 pounds, and usually more so like in the 5 pound range on the resistance. Get you like a banister, something you can hook the band onto, and then you stand up just like this gentleman's doing. And you want to do resistance when you are taking if you have your palm on your belly and then going out away from your body. And then you turn around and do it the other way, where you start in this position. So the band would be going this way, and you start this way, and then you take your hand from here and go to this position with your palm towards your belly, pulling against the band, which is out here. That's going to help you strengthen the rotator cuff in multiple different directions so you can strengthen all four of those muscles and keep them strong. I would say out of all the things that I could tell patients to do in the prevention department, this would probably be the most helpful. If you could make these exercises a part of your regular everyday routine where you do them for just 10 minutes, this would probably positively impact your longevity and doing the things you want to do the most. A lot of times, if you have an actual tear, if it's an acute tear, it's going to be someone who has fallen and they're reaching out whenever they fall, and they fall on an outstretched arm, or something falls off of a table, or a picture falls off the wall and you reach out really quickly to grab it. Those are the times when you're going to put that rotator cuff at risk of being torn, especially if it hasn't been strengthened by these exercises. And the patients say they have weakness, discomfort trying to reach my arm over my head. At home, you want to do rest, ice, and pendulum exercises, even if you have one of these acute events where you go to grab something. I got a patient, he tore his rotator cuff just lifting a bag of trash like this to throw it in his trash can. It's just something he had not done a lot of times, and he had not been working to keep his rotator cuff healthy, and he tore it. For the first few days, you want to do these things. Pendulum exercise is what this lady's doing right here. You lean forward, just let your arm dangle, and just make big circles with it. After about a week or so of doing that, it's going to feel a good bit better. And if you still have weakness, that's when you come see me. Because in that scenario, that's when we want to get an MRI, most likely, and determine, do we have rotator cuff tear? Do we not? Because if we do, we may have to treat it, oftentimes with surgery. If we don't, hopefully we can do some conservative treatment, physical therapy, things such as that nature. So we're just marching up the upper extremity here. We're going to get to the neck, and then we're going to march down the body a little bit. Cervical spondylosis with radiculopathy. Now, I know that's a big mouthful, and that's basically doctor words for neck arthritis. Neck arthritis looks something like this down here. Now, these x-rays are not too terrible in terms of the arthritis, but what I wanted to show you with this picture is how you sit and the posture you have can actually have a true effect on your body, on your anatomy, on your skeleton. And so whenever we sit at the computer, if we are sitting leaned forward like this, hovering over our computer or looking at our phone with the weight of our head in front of our shoulders, if we're doing that regularly, you can take a normal looking spine x-ray, which is this one, and turn it into this one, where the neck is actually curved in the wrong direction. So your neck should have a curve to it, but it should be curved slightly back like this. This is what's called a lordotic curve. When it curves the opposite direction, that's what's called a kyphotic curve. And if you have a kyphotic curve, that's going to be putting pressure on the disc in the front of your neck, and it can cause that disc to squirt out the back, which can lead to pinched nerves, and that's going to lead to pain, numbness, tingling that's radiating down from the neck into the arm and go all the way down into the hand. Sometimes it can feel like carpal tunnel or cubital tunnel, depending on how bad the symptoms are. So with this, you're going to have neck pain, usually pain with actually moving your neck, arm numbness and tingling, and sometimes you can get focal weakness depending on which nerve root is affected, because at each one of these circles that you see here, there's actually a nerve coming out at each one of those levels, like I was talking about earlier, that then become the named nerves in your arms and legs. If you have compression here at one of these nerve roots, it could cause specific weakness of like your pectoralis muscle, your deltoid muscle. And that's just showing us where the problem is. Prevention, posture awareness. Like I said, keeping that neck back, keeping your head over your shoulders. Your head weighs more than you think. And if you put all that weight out in front, your neck is working really hard to keep your head where you can see something. And that can lead to physical changes in your neck. So you want to have this good position, knees bent 90 degrees, elbow bent 90 degrees. They don't quite have as much air behind the elbow as I'd like for them to, but other than that, they're looking okay. You want to be able to look straight ahead, top of the monitor, right about eye level. And so this is a good ergonomic position that you want to be sitting in to help prevent you from putting your neck at risk for developing arthritis in it. Patients usually say they have neck pain with shooting pain, numbness, tingling into the arm. This is described as an electrical shooting, shocking pain that just runs down the arm. And this is a spectrum where it can present from as much as little as a gnawing, kind of achy pain, all the way to a very debilitating pain. Some of my neck and low back patients who have true radicular symptoms or true nerve root compression, they're some of my more uncomfortable patients, and they usually come in basically begging for me to help them get better. And so we got to do everything we can. At home, you want to try a neck support pillow. I honestly can't tell you that I've read any studies that they make a huge difference, but I have had a lot of anecdotal evidence with patients who tell me, hey, I got this new pillow, it's got a neck support, and it really helps me. It does make sense to me though, because you're basically still trying to keep your neck in an anatomic position. Gentle stretches. I have to remind myself to do this. I'm documenting on the computer all day. I'm sure Jacob probably has some of these symptoms as well. We're sitting in front of the computer, we're trying to have good posture, but sometimes we don't. And so I'll have to stretch every now and then. You want to grab at the top of your head, try and keep your shoulder down and stretch, and that'll stretch this side of your neck. And then you go the other way, and you're kind of pulling slightly forward and to the side. And then you just go straight forward. It's going to stretch those muscles in the back of your neck, loosen them up, and remind you also to be to put yourself in a better position. If you have focal weakness, continuous numbness and tingling, perpetual or persistent pain, those are all the reasons to come see me so I can try and help get you better. Lumbar spondylosis. Again, that's just the fancy orthopedic doctor word for arthritis in the spine. So lumbar spondylosis is going to be arthritis in your low back. Um, and this overlaps with something called lumbar stenosis, which you may have heard of. And lumbar stenosis is what actually causes true narrowing of the spinal canal in the lower back. Again, the issue here is that you're going to have compression of the neural elements. So you're going to have a disc that's probably putting pressure on the nerves where they're coming out or the nerves where they're bundled together in the middle. So this diagram gives you a pretty good picture of what it can look like. This is a normal disc space here because your back, all the way from your low back to your neck, is a series of bones stacked one on top of another, like this. And then in between each sets of bones is a disc. And you want your disc to be nice and smooth like that. Sometimes the disc can get an injury where it shrinks like that. You can have a disc bulge. You can have a true herniation where the disc actually protrudes out from the sac that it's in and escapes that. You can have disc space narrowing, or you can have these degenerative changes where if the disc space narrowing has been there long enough, the bone itself starts to develop more bone. This is what arthritis in the back looks like. Very similar to arthritis in the thumb or the shoulder, but a little bit different because you got the discs to deal with. In the low back, the symptoms are going to be leg weakness, pain that's worse with standing or walking. You're going to prevent this by doing core strengthening. So you want to focus on keeping those abs strong, doing your crunches, doing your sit-ups as best you can. It really is true that if you don't use it, you lose it. So you want to stay mobile, you want to stay active, keep moving. By keeping your core muscles, your belly muscles strong, or as strong as you can, that's going to help stabilize your spine, and that's going to help take the pressure off of these discs so they're not as likely to thin or become arthritic like this right here. And avoid prolonged standing as long as you can. I mean, I know sometimes patients have jobs they have to stand. Just make a point if that's the case, then if you go to the bathroom, stretch your back, bend from side to side, just loosen those muscles up. Don't let them stay in that one tense position the whole time you're there. One of the most common things patients say with this is they say, I have to lean forward on a shopping cart. Anytime I go to the grocery store, I got to have a cart and I've got to lean forward on it. There's an actual anatomic reason for that. When these discs are pooching out the back there, when you're in this extended, fully standing up position, your back is leaning back. You're actually putting pressure on the back side of that disc, making it push out more, putting more pressure on the nerves and making your symptoms worse. So when you lean forward and the spine comes to a more relaxed forward position, that actually takes some of the pressure off and makes it feel better. So that's a real thing where patients are like, man, I have to lean on this shopping cart. If I try to walk in the grocery store for more than 15, 20 minutes, I get numbness, tingling, pain, and I have to sit down. If I sit down for 2 minutes, it gets better, and then I can get going again. So that's an indication that we may have some compression in the back we need to look at. At home, you want to do cycling, lean forward for relief, core exercises, some of the things we've already talked about. Cycling is just a good low impact exercise that'll keep you active, keep you mobile, and it's not quite as damaging to your joints. Again, if you have leg weakness, definitely if you have bowel or bladder symptoms. So what I mean by that is if you have continuous pressure on these nerves at the base of your spine, it actually can lead to bladder dysfunction or incontinence. Now, not so much like I can't quite make it to the bathroom and maybe I spotted a little bit and but I still was able to go. That happens to a lot of people, especially female patients that have had more than one child that are over the age of 55 or so. That's pretty common. What I'm talking about is you're having a conversation, or maybe you're at home and you're in your bed and your bladder empties and you didn't even realize you had to go to the bathroom. That is a very concerning sign. That's a worrisome sign that you may have pressure on your nerves that you need to get checked out. And for that, I would definitely recommend getting seen sooner rather than later. Knee arthritis. This is probably the most common thing because I treat general orthopedics, so I see knees, but I'm an upper extremity specialist. So I don't see as much of this as some of my lower extremity specialist colleagues, but this is probably something that almost everybody has heard of or seen someone that has had it. So this is degenerative changes in the knee cartilage. So remember, I was saying when the cartilage becomes diseased, it becomes brittle and soft, and it starts to rub away, and the bones start to rub on each other. So
Arunch my case here for that.
this is a model
Okay.
showing. This is a normal, healthy looking knee right here. And then over time, the arthritis can become worse and worse. And if the cartilage gets completely worn through, when these bones start to rub on each other, you can see over here, there's no abnormal changes in the bone. But here, this bone looks like it's almost kind of melting. That's not really what happens, but it forms new bone because your bone is actually trying to fuse that joint so it'll stop moving, so it'll stop hurting. That's why the arthritis makes you stiff as well as painful. So symptoms, stiffness, pain with stairs, pain with walking, weight-bearing exercises are going to make this very uncomfortable for you. You want to maintain a healthy weight. The lighter we are, the less pressure there are on our joints. There's a lot of truth to that. So if we are, someone is significantly overweight, they're putting more pressure on their cartilage each time they take a step, and that can lead to damage over time. Low impact activities, cycling, swimming, those sorts of things. Patients just say, I have knee pain with standing, I have knee pain with walking, I have knee pain when I try to do a deep squat. Those are all the ways this is going to present. At home, you may need to try a walking aid like a cane or something like that. But I would say if you've gotten to the point where you feel like you need a cane or definitely a walker, come on in. Let us see you. Hopefully, we can help get you better. The low impact exercise that we talked about, ice and heat. Ice and heat can actually help a great deal for this. There's something about that ice and heat combo that really helps arthritis because it decreases that inflammation. It decreases the inflammatory signal cascade in the joint. And so it leads to less swelling, less fluid in the joint. And when that fluid comes out of the joint, it actually makes it feel a lot better. So I highly recommend that. Whenever your daily activities are significantly limited, you're not able to walk like you want, you're not able to walk as far as you want, maybe not able to play pickleball like you want. That's when you come see me because my goal, one of the main reasons I went into orthopedics is I like getting people back to the activity level that they feel like they need to enjoy their life. That's my whole goal. So if you're not there, let us know. Come see me. Hip arthritis. I'm not trying to beat a dead horse with this arthritis thing, but that is a good bit of what I see as an orthopedic surgeon. So I just want to make sure you guys know how it can present. Same thing with cartilage damage, but with hip arthritis, believe it or not, most of the time the pain is in the groin. So kind of like inside, next to your zipper. That's really where you're going to have pain with hip arthritis. It's not so much on the outside of the hip, although a lot of people think that. That's usually going to be something else. That's going to be a bursitis or a muscle strain, sometimes a low back issue. But true hip arthritis is usually in the groin. That's going to lead to stiffness, sometimes limping. High impact activities and sports are definitely going to be things that make this worse. Now, patients usually tell me that they have pain when they're getting in and out of a car. So lifting your leg to get out of a car or get in the car. Putting your foot on the opposite knee to put on your socks and shoes. Those types of things are going to be really difficult. You're going to have less mobility and more pain when you have hip arthritis. That's because that internal external rotation of the hip really causes those two surfaces to rub together. And if there's not enough cartilage there to support that range of motion, it's going to be painful. Low impact exercises can definitely be helpful in prevention. Again, using assisted devices as needed. Heat and ice. It works really well for arthritis. Again, if you're not able to do the level of activity that you enjoy or that you think you should be able to, that's when you come in and see me so that we can help get you there. And then I wanted to end on something that might be popular for you guys, may not, but overall pickleball has grown in popularity. I know I like it. I love to play. My biggest problem is getting somebody to play with me. So pickleball injuries are very common and they're becoming more common. Jacob was saying I'm a member of the American Academy of Orthopedic Surgeons. That's a national group, but one of the things that they did this year is they actually sent out an article trying to educate all orthopedic surgeons in the country about pickleball and the injuries because there's been so many patients coming in with pickleball injuries. These are going to be sprains, strains. Usually they're going to be caused by falls, especially in my patients that are, 55, 60 or older. It's not so much that they're tearing tendons and ligaments, although they can. They usually are the patients that fall and sustain an actual fracture or broken bone. One of the most common fractures I see from this is someone who falls. They fall on their outstretched hand like this, and they break their wrist right here. It's called a distal radius fracture. I see it very commonly, and it can be something that I've seen people even think that maybe they had a wrist sprain, and so they didn't seek treatment very early. That can make getting that corrected difficult down the road. If you fall and you injure your wrist, if you have swelling, pain, decreased range of motion, come see me in the office. And a wrist fracture is one of those things where a lot of times you go to the ER and you go to the urgent care, and Jacob's going to do a great job to take care of you in the urgent care. But sometimes if you can come see me first, we actually can kind of get you through the process a little bit quicker. So as long as you don't have any bones sticking out through your skin, and as long as you can tolerate the discomfort to come see me that day or the next day, that may actually speed you up through this process a little bit. But if you can't, or if it's definitely something where you're not able to move your fingers or it's significant pain, absolutely ER, urgent care. That's what those facilities are there for, and they'll get you preventionally or they'll get you stabilized adequately enough to then get you to me in a couple of days so we can get you taken care of. Shoulder, elbow, tennis elbow, things we already went over. That's going to be really common with pickleball. Ankle sprains. People trip, fall, they sustain an inversion style ankle injury. This is where an ounce of prevention is worth a pound of cure. I tell my patients, you need to play to the level where you are at, okay? And that can be difficult sometimes. We're going out to play pickleball to have fun, to stay fit, and to stay healthy. And so if we're overdoing it, if you sprain an ankle at 55 or at 58, that's going to take a lot longer to recover than it does at 18. Okay. And so just want to be mindful of that. So even myself, I try to think of myself as a young, healthy dude who's still very able, but I try to play within my means. So maybe we play doubles or, we set up rules. Like when I play with my dad, he says we can't hit the ball, then he spins. He says he's going to hurt himself if I do that. And for proper shoe wear, that's something that you can do. So you want to wear high top shoes with laces that will support your ankles. It's probably one of the biggest things. Stretching. Stretching is going to help a ton. Stretch your wrist, stretch your legs, stretch your back. You can actually do that stuff pretty quickly in about 10 minutes to warm up to go play pickleball. And it's gonna help you feel better, probably help you play a little bit better. And it's going to help prevent you from having some of these injuries. It'll prevent you from hopefully falling and end up looking like this guy right here. But after the fall or repetitive play with continued pain, that's definitely going to be things to look out for. RICE therapy, so rest, ice, compression, elevation. Compression is usually just with a wrap or a sleeve. Those are some of the first things to try, unless you are concerned you have a broken bone. If you think you have a broken bone, come see me. We'll get X-rays. We'll either we'll confirm that or we'll figure out that's not the case. At-home braces, I'm totally in favor for, as long as you feel comfortable putting them on and feel that you're doing them appropriately. Activity modification, that's more so going to be in the prevention category, I think. Like I said, play into the level where you're at. Okay. If you're unable to bear weight on something like an ankle that you've twisted and you can't walk on it, seek care. You can feel a pop in the back of your ankle. That could be an Achilles tear. That's a big deal. You need to come see me for that as well. If you have severe swelling, so if it's swollen and it stays swollen overnight to the next day, come see me. Persistent pain. Man, this thing is continuing to be sore. I fell on my wrist and it's 2 days later and I still don't feel like I can move it like normal. Come on in. There's a lot of small bones in the wrist that can be damaged with these types of injuries, and we want to make sure that we take care of them if they are. That is, in terms of the talk and the common things that I see, that's most everything that I wanted to cover. This is a picture of a map of where we are located. So if you're familiar with the Douglasville area, you've got I-20 here. You've got Arbor Place Mall right in here. Texas Roadhouse is like right in this area. And then the Target is right here. And right behind Target is Jacob's office, the urgent care, and my office, the orthopedic office, is attached to that. So it's all one building. It's Piedmont Orthopedics, Ortho Atlanta. This is our address. This is where we're at. And this is the phone number. We've got multiple ladies up front answering the phone, so should not have any issues getting in. But yeah, that's the phone number for us. And that was pretty much it. This is my family. That's my wife and my 3 little girls. So they're, the main reason I get up and go to work every day, trying to support them and then also getting to treat fine patients like you guys. And then my wife, you can't really tell here, but she's pregnant in this picture and she's actually due next week. So we're hoping to have a new baby next week, and it's another little girl. So 4 daughters for me. Blessings abound. And that's all I had. But I'm open
Thank
to
you
any
so much.
questions or anything you may have.
Yeah. Thank you so much, Doug. We really appreciate you so much. You've been a blessing and it's been an eye-opener for us.
Thank
So
you.
at
That's a
this time, we
beautiful
are going
family.
to open a short period of time. If you have any questions, Doctor is here to help us out. Me pacho baby aye dui ye bue kwan ato hɔ. Wo wɔ asɛmbisa ɛwɔ nkyerɛkyerɛ yi a ɛkɔɔ so yi a me pacho ɛkwan da hɔ. Ye bue kwan kakraa bi na me pacho webisa. So the floor is open now for your questions. We have something on the chat. Somebody was asking what causes foot pain.
Yeah,
Pain in our foot.
I was just looking at that. So, it's going to be really dependent upon where your pain is and how long it's been going on. Really, at the base of your big toe, that's the most common area to get arthritis in the foot, and that's something called hallux rigidus. That's pretty common. And again, that's going to be an issue with the cartilage where the toe connects to the foot. You can also get a bunion there. A bunion is actually not necessarily from arthritis. A bunion is when the big toe is kind of bending over into the other toes. You get that big bump on the inside of the big toe, and usually that'll rub inside your shoe and be painful. That's actually due to a bony deformity and sometimes a muscular issue that causes that toe to move over. So sometimes we can correct that in the office with shoe inserts. Sometimes it requires surgery. Other than that, you can get midfoot arthritis. There's definitely some other less common things, but you can get what's called a Morton's neuroma. It's an issue with a nerve in your foot. It'll cause numbness, tingling. It feels like you have a pebble in your shoe, that sort of thing. Those are some of the more common causes of foot pain, but a lot of it's going to be determined by, again, like where your pain is. Did you have an injury? How long has it been going on? Those sorts of things.
Okay. I have a question. There's a pain in this right knee, which is not relieved by pain medicine. They said I have a meniscus tear.
Mhm.
So is surgical intervention the only means available to resolve that pain?
No, ma'am. Meniscus tear, a lot of it depends on age. So if a patient is under 40, and they have a repairable tear, then that's when surgery is most indicated because we want to try to repair that. If a patient is over 40, a lot of times, even if we try to repair it, it's not going to heal because the meniscus doesn't have good blood supply. So Over 40, we find that even those tears that can be repaired don't always heal very well. And so in that scenario, usually I recommend either an injection, physical therapy. Those two things usually can help a ton. And then it's going to depend on whether or not you have arthritis along with the meniscus tear. If you only have a meniscus tear and no arthritis, and you've done an injection and it's still hurting, then a surgery could be beneficial. You do like a knee scope, you go in and you basically clean up that teared or that torn edge of the meniscus to give it a nice smooth edge, and that can help a lot. If you already have arthritis in the knee, then the only definitive treatment for any of these arthritic problems, whether it be the thumb, the knee, the hip, the only definitive treatment is some sort of surgery, a lot of times like a joint replacement. But we usually do a lot of non-operative treatment leading up to that. Injections, therapy, the heat, the ice, anti-inflammatory medications, those sorts of things. And it's only if those things stop working that we have to talk about the surgical options.
Okay, thank you.
Mm-hmm.
I have a question.
Yeah.
Okay, so my question is that I tore my ACL in the past many years ago during sport activity,
Mm-hmm.
and I was told to do a surgery, but I never really did it. So now what happens is that whenever the weather changes and it becomes very cold, when I'm walking, I can hear this popping sound in my knee. But of late, whenever it's like I decide to squat or do anything, it's like it hurts more. Now it looks like the knee has become very stiff. So I can't really do the squatting that I normally used to do anymore. So what do you recommend me to do?